So now it's a pleasure for me to introduce our next speaker, even if I'm not sure if anybody has to introduce Jacob van Klaveren when it comes to mixture toxicology in Europe. Jacob serves as a senior advisor to REVM on the issue of mixture toxicology, but has been coordinating numerous big European projects, some of which we have been involved in as well, like the Euromix project. It is currently also working in the big partnership on the assessment of risks from chemicals coordinated by ANSYS as a work package leader like me as well. Jacob, thank you so much for coming. You will be presenting on mixture risk assessment from science to regulation. I think that's a very important topic, and the floor is yours.
Yes, thank you, Philip, and thanks BFR organization team for inviting me here. It's a real pleasure. Congratulations with your 20 years existence. So it's a real pleasure. So I'm not talking too much about science. Previous speakers have talked about science, but how science is used in the policy and in implementing mixture risk assessment in Europe. For this, I have a little different scope. So I first want to stress the importance of European cooperation in several ways to get something done in the European policy. It's not easy to translate all that data into a yes-no decision, as you said, Maurus. That requires a lot of discussion, but also a lot of cooperation in Brussels. Then I touch a little bit about the regulation itself, where is mixtures addressed, where not, what is in the chemical strategy, and how are we working towards solutions for this chemical strategy, either by the EFSA roadmap or mixture risk assessment, or by national initiatives, or by PARC. So that's the content of the presentation. So first, let's think about the first regulation that addressed mixtures, which was pesticides. And they were aware already before EFSA exists that something should be done on mixture risk assessment in pesticide. So they wrote in their regulation, we need to consider mixture risk assessment effects. There it's called cumulative effects, but it's all the same, it's mixture risk assessment effects. And then in another part of the regulation said, we should implement it as soon as EFSA has the methodology agreed. So that's very important to have a harmonized approach in Europe and to work on that jointly. So a lot of support there to EFSA. And here I'm just looking back 20 years ago when BFR was funded, when you were born. And I want to make an analog to this baby, which is actually my son. He was also born in that year. And he is crying there. And why is he crying? Because he could not eat different fruits or vegetables at the same moment. One pear might have pesticides and an apple might have the same pesticides, but it's not combined in the regulation. So he's crying for that reason. So at that time, there was a lot of concern. He's not crying for BFR being funded. He's crying for that reason. So there was a lot of concern among consumers about me being the father of that son. And of course, concerns in Parliament already at that time. So the Commission speeded up, they put it into regulation, they made funds available, like the Acropolis projects, which we coordinated before. And the Acropolis project was really successful. A lot of member states came and they used the tools and the concepts, and they had questions answered to their local parliaments in the member states. And at that time, DG sent a director called Bernard Oel and said, let's work together on this issue. Maybe you can help EFSA to speed up with the implementation by having partnerships. So from there on, BFR, RFM and EFSA director agreed on partnerships. And the first one started in 2015. EFSA developed a methodology on assessment groups for the nervous system, for the thyroid. We did the exposure assessment in that methodology. And then it was followed up by an expert elicitation, because there are still a lot of conservative assumptions in our approach. So we might be on the safe side. We might miss something as top of the iceberg, but expert elicitation and weight of evidence is part of modern society and modern science. So we applied all those techniques in the pilots. Then it came down to having discussions with the Commission on how can that be used. So we had a model and we validated that model, and it's well seen as very useful. It's a probabilistic model, Thomas, so we use probabilistic distribution. It uses cloud computing, so we serve you as well. Not in full speed, but we have cloud computing techniques. Now we're entering the third partnership with EFSA about making this implementable in Europe with the Commission as a regulatory process. So that's the good news. But then in the second partnership, we spoke with the Commission in many different standing committees, in trilateral meetings between EFSA, RIVM, and the Commission, and we decided on the threshold of regulatory consideration, which is a kind of safe level, yes or no. If it's above, it's yes. If it's no, then something should happen by the risk manager. And that was set at a margin of exposure total of all the pesticides that were in the group of having an effect on the nervous system. And if that's above 100, it's a yes. It's good. If it's below 100, it's a no. So that was well discussed also with a lot of cooperation within Europe, but then from the risk manager perspective. And then it's good that are all the chemicals that are already on the market, in this case pesticides, but it's good to realize that it goes about a new chemical that needs to be authorized. That's in the regulation. So what if a new chemical has the same toxicity as all the existing chemicals already? So for this is a prospective risk assessment of mixture risk assessment, and that's also an analog in the mixture assessment factor now being proposed in REACH. It's about a new chemical that needs to be entered in the market and how is it related to the toxicity already there. So that methodology was also established, and now we are entering in the third partnership. It was signed by Bernard Uhle, my director, in, I think it was in early this year. It took a while, but anyhow, it was signed, and it's based on MCRA software to get that fully implemented in standard regulatory actions. It means that the Authorization Board for Pesticides could use the tool, could do prospective risk assessment with it in the future, and could combine it to all the data that they need to take that yes-no decision. So that's what we do, but there's also a lot of co-creation because aggregated exposure via different routes, food and non-food, is not addressed yet. That's the biggest gap in regulation at the moment. So if somebody has a model of non-dietary exposure, we can co-create to make that better. So, and then capacity and training and governance of this model in a European context is also very important. So we are discussing that now. Then another form of cooperation was indeed the Euromix project, as you said, Philip, and that was a quite successful project, integrating in vitro data, kinetics, different endpoints, in vivo data, combining it with all the exposure data into this MCRA tool, so to say. And that was tested by Alfonso Lampo and other people. But BFR wrote a very good article on this, on the international implementation. Together with Alan Bubis, they had organized 4 harmonization workshops with the USA EPA, with the Codex Alimentarius, with the European Commission, and that was very successful. And ever since, you see a lot of BFR people around, like Stephanie or Jens, promoting this article and promoting this very good cooperation in Euromix. So thanks a lot, BFR, for that good cooperation. So what is next? We have to continue with new cumulative assessment groups, and I think BFR is discussing it with EFSA. We have to think about the chemical strategy, because now we talk only about pesticides, but we have PFAS, as we learned from Anne-Marie. We have overarching issues. So there is a lot more to do. And then PARC was already mentioned a couple of times. So, but I also want to come back to your anniversary, Barbara, which was before the summer break. And I really appreciate that, because that was the first conferences that really nicely touched upon the chemical strategy, mixture assessment factor, and how it's related to scientific-based approaches endorsed by DC Sante. And that was a very, very nice discussion, and Philip was there, and I was there, and I had to report and to make the conclusions from the workshop. That was quite a challenge. But anyhow, it was about the regulatory needs from different perspectives and about the scientific progress from different perspectives. So all the publications are on the website there from EFSA. Here is the chemical strategy. It clearly says that something needs to be done now. It has taken a long time, and so there is not so much implemented yet. So they are discussing a mixture assessment factors and or more targeted methodologies, as we see from the pesticides. So both are in the chemical strategy. It's not the one or the other. It could also be a combination, but something should be done now. So from DC Sante, we had the presentation on the one conferences pleading for scientific-based and data-driven approaches from the regulatory perspective. Then EFSA also want to have a strategic vision and a strategic roadmap on mixture risk assessment. And there again, we work nicely together with Philip and with DTU and with Wageningen Research University. And this is now being published 2 weeks ago or 3 weeks ago. It includes communication aspects. It includes stakeholder engagements, which was rather new. But it was a real challenge to have this published, but it's now there. And it contains a lot of interviews, workshops with the Commission. How did you perceive our proposals? We talked with the EFSA panel chairs. So what is going on in your panel? How can it be used in the regulatory process? So this is what you see. Indeed, we work in silos. So we looked at different silos. We talked to nearly all regulators from those different silos, like Frans Verstraeten, like Almuth Bitterhoff for pesticides, like Jiri Sokbar from additives. We talked to the panel members of those different silos, and we made a workshop discussing our proposal on the roadmap. So it's more than only science, it was the dialogue, it was the process that made it successful. So, and indeed, we need a kind of overarching regulatory approach, and that's a little bit the long-term vision. But if before you are there, you also need more hazard data or tox data on the different silos itself. Pesticides is well regulated now with the food, not for the non-dietary part. And some other areas need more data before you can do something. Then we have PARC, which is the big initiative again. There we have different work packages, but the work package is about 75 million euro or even more. You have more, Philip, 100 million or something. So it sounds small, but it's very, very large. So we are coordinating as RIVM together with KEMI the project innovation in the regulatory process to be implemented in policy, so to say. It's about IATAs, that's done by others, but it also might help you, Maurits, a little bit with IATAs. And here I want to focus on the integrated exposure assessment. So we also need some tox data once in a while, so we do nicely international cooperation again with ANSES and with Philip and with all those others that are involved in Work Package 5. Anyhow, what are we doing that has a focus on making overarching regulatory risk assessment possible is also to look at the human biomonitoring data. It has been said by the previous speakers. What we do in this project here is to be connected to all the human biomonitoring studies in Europe, from the HBM study, and even doubled by national studies now. They all have organized the data quite nicely, raw data, not aggregated data, and we link them to this MCRA tool, and we ask them to do statistical techniques with SNMU and other tools that have been proposed in literature, and we put them together, all the partners with HBM data from the HBM4U study, new partners with HBM studies at the national level, and we link them to MCRA. And next week they will be trained on how to do it, and in coming weeks, months, they will be able to do probabilistic risk assessment based on HBM data all over Europe. So that will help, and we also have very good connection with IPCAN database, with application programming interfaces, etc. So that will help to speed up and to get an overview of health effects in real humans. So that's a little bit what will happen there in PARC. So it also needs models, kinetic models, because internal dose is not external dose, as we know. So these kinetic models are also well organized by 10 cooperation partners in this project. And then I talk about INERIS, ANSES, RIVM itself, many others. So that will be linked, and then we are able to compare the intake in humans with predicted intake by models. And if you have that comparison, we can also go to the regulatory process and say, what can you do about it, probabilistically? So where you exceed a health-based guidance value, what can you do about it? So that's the message. So in conclusion, now the boy is grown up. It's 20 years, 22 years. He is not so much worried about his fruit and vegetables anymore. He eats beef and hamburgers and whatever is forbidden for sustainability. But anyhow, my key message is here, international cooperation is key to get things done. So really thank you for being a speaker here and happy to take some questions.